Once again, today's program focuses on mental health, and this is Mental Illness Awareness Week. Joining us now from the CMHA, that's Canadian Mental Health Association, Niagara, we have Heather Gillespie. Welcome to the program, Heather.
Hi, thank you.
Heather, 1 in 5 Canadians will experience a mental health problem or illness in any given year, 20%. That's quite a large number.
Absolutely. And what we often say is the other 80% are impacted, either because they're family members, friends, employers. So mental health and mental illness affects all of us.
There's also been a stigma about talking about mental health illness, or mental illness, I should say. So that 20% number could be a lot lower than we are actually aware of.
That's true as well. I think that we, have no problem talking about cancer or diabetes, but when it's mental illness, that there's some stigma that somehow, people are faking it, or that they're just not strong enough, or that they should pull themselves up by their bootstraps. I can't imagine that you would ever say to somebody with diabetes, for instance, you really just need to balance out that blood sugar. If your body is not producing the insulin that's required, then you need medication. That's not to say that everybody with a mental illness needs medication. There's a huge range, a continuum, if you will, from mental illness all the way through to mental wellness. And we can all be found on that continuum.
And when we talk about mental illness and medications, there's also another stigma that, you shouldn't need medication to fight that mental illness.
Yeah.
And that's a huge factor.
Absolutely. And I think what we know is that things like depression, for instance, are linked both genetically, and family members can be predisposed. And there's also neurochemistry in your brain that relies on neurotransmitters that can be impacted in depression, such that your physiology is actually working against you in terms of maintaining your mood. So that medications are targeted for those particular physiological realities, and it's not that somebody should just be able to will themselves out of it.
Mental Illness Awareness Week, what is it all about? Other than just awareness, what are you trying to achieve?
And that's a great question. I think one of the messages that we try to repeat is that there's no health without mental health, in that mental health can buoy somebody up if they're dealing with a physical illness as well. And it's also that as all of us, we need to look at how are we maintaining our mental wellness rather. So it's things like being mindful. Right now, in the midst of all things COVID, I think we're finding at the agency that we're getting reach out calls from folks that would not ever have identified as having mental illness or mental health issues. And it's the stress, it's the isolation, it's losing your job. You may have lost a family member and not been able to say goodbye if they passed away in hospital, for instance. Or if somebody passed away that wasn't related to COVID and you can't have a funeral. All of these things are increasing general stress in the community. Folks are feeling more isolated than they would have, particularly if they're living alone. And because we're all, being asked to physically distance and keep in smaller bubbles, that there's individuals who are not having that access to social supports in the way that we would have normally. So this year, more than ever, we're really asking to have that awareness that mental illness is something that we are all impacted by, and that we all have a role to play in keeping each other mentally well, and looking at how do we support each other.
Have you found that there are some people who had developed strategies prior to COVID to deal with some of those issues, and now, because of COVID, they're slipping back into their anxieties, slipping back into their depressions?
Absolutely. I would say as an agency, when COVID hit, we transitioned, as I was saying to you earlier, from being a face-to-face provider to having to go to phone or virtual, either by text, or we're using Ontario Telemedicine Network. And the challenge is, without that face-to-face support, we noticed that for some individuals who really rely on that in-person support, it has been more difficult.
With schools opening, younger people as well?
Oh, for sure. I think younger people going back to school, we've heard of a lot of folks feeling very anxious, not wanting to go back, worrying about wearing the mask, worrying about how they're going to get all their work done, particularly for folks that may not have access to computers in the same way. If you've got multiple kids in one family trying to access that Wi-Fi bandwidth to get their homework done, I think it's thrown all of us into a bit of a spin.
CMHA did a poll in August. What was that poll all about?
That was CMHA Ontario, and it was really reaching out to Ontarians to understand how COVID had impacted their mental health and what their concerns were in general. And really what we heard is that people feel like as the pandemic gets longer and we're heading back into the darker days of fall and winter, that there's this sort of anxiety that it's going to be a real mental health surge, and demand on mental health services in our communities is going to exceed capacity.
You mentioned mindfulness, I think was the word that you used.
Yes.
What are some of the other strategies that people can develop, can use to support their mental health?
That's a really good question. I think first and foremost we say protect your physical health first. So follow public health guidelines, mask, distance appropriately, wash your hands. And then from a mental health standpoint, it's about self-care, making sure that you're eating well, sleeping well. These sound like simple things, but it's how important it is to maintain those routines that are really easy to let go of if you're at home always, as opposed to being at school or at work. Being mindful is really things like doing exercise, taking some time out to meditate, have a bath, go for a walk. When I like to hike, and one of the things that I really find is that when I'm hiking at Short Hills or wherever, you forget that COVID's a thing, because the natural world continues to do its thing. So some place where you can just relax, focus on doing things that fill you up, that are enjoyable for you.
Is there any drive to raise funds during this week or on October 10th, which is World Mental Health Day?
Not in particular. I think that we're, as mental health providers, all of us are always open to receiving donations. We are funded through the Ministry of Health, but we also rely on United Way donations and other Branscombe Family Foundation as examples. And I know other organizations rely on different funders as well. I think this week is really about building the awareness and just asking people to ask those questions. And if you're experiencing concerns or you would like to talk to somebody, please know that there's resources available.